Hello, I am Beth Ann Clayton and I am representing the AANA Foundation Task Force for Poster Abstract Submission. I will be reviewing the non-research category, which is inclusive of evidence-based practice projects or quality improvement projects. At the AANA Annual Congress in 2023, at the Program Director Luncheon, there was much discussion about the abstract submission and review process. Dr. Jordan and the AANA Foundation board members shared some of the challenges regarding the quality of the abstracts received, including poor writing, incompleteness, lack of substance data to support the findings, and inconsistency among reviewers. Dr. Jordan asked for volunteers to serve on a task force to revise the abstract review process, including criteria for submission and review criteria. The task force evaluated the current poster abstract process and identified gaps, including the abstract applications, the criteria for each category of abstracts, and criteria for reviewers. The task force discussed suggested changes to the abstract process and created a new abstract process, including the following revisions: application for abstract categories, the review process, criteria for reviewers, and to develop educational videos for applicants and reviewers. In the revision process, the poster abstract categories was decreased to 3 major categories. Number 1 is the research category, which includes qualitative and quantitative research. The second category is evidence-based practice and quality improvement projects. The third category is case studies and innovation. An evidence-based practice project uses the best evidence from published research studies and combines it with clinical expertise to guide clinical practice, resulting in the best patient outcomes. Please note, a literature review only will not be accepted. A literature review is defined as a review and synthesis of existing published literature on a specific topic or research question, but does not include a plan for implementation. Please note, an evidence-based practice project must include a plan for project implementation and an analysis of the implementation articulated in the methods section. The 3 qualifying questions for an evidence-based practice project include: number 1, is your project a literature review? If the answer is yes, literature reviews are not eligible and the abstract will not be accepted. If the answer is no, proceed. Question number 2, have you provided evidence from the literature and combined it with the clinical expertise to address a problem? If the answer is yes, continue. If the answer is no, you must choose a different category. Question number 3, have you implemented the evidence into clinical practice, or is there a well-articulated plan to implement the evidence into clinical practice? If the answer is yes, proceed. If the answer is no, the abstract submission will be considered not complete and therefore not accepted. A quality improvement project is a data-driven strategy to improve processes, costs, productivity, and outcomes within an organization based on evidence from the literature. The focus is on the current structure within the institution that needs to be changed. A literature review only will not be accepted. For a quality improvement project, a plan for project implementation and the analysis of the project implementation must be articulated in the methods section. The qualifying questions for a quality improvement project include: number 1, is this a literature review? If the answer is yes, literature reviews are not accepted and your project is not eligible. If the answer is no, proceed. Question number 2, has your project been implemented, or is there a well-articulated plan to implement your project? If the answer is yes, proceed. If the answer is no, it will be considered an incomplete submission and not accepted. Question number 3. Does your project improve internal systems or processes in an organization to improve cost, productivity, and/or quality outcomes? If the answer is yes, proceed. If the answer is no, choose a different category. An impact statement is required for abstract submission. An impact statement is a summary of how the project will impact or potentially impact the care that CRNAs deliver. The impact statement should be less than 200 characters. After thorough review of the abstract, the reviewer will determine if the abstract submission contains a critical flaw or weakness that would preclude the abstract from being accepted, such as being inaccurate, incomplete, or a literature review only. If the reviewer determines the abstract should be rejected, they must provide a comment, but no numerical score, and they do not need to continue with rubric scoring. Abstract rejection will occur if the abstract is a literature review only, or if the evidence-based project or quality improvement project does not include a plan for implementation or analysis articulated in the methods section. If the reviewer determines that there is not a critical flaw or weakness, they will continue on with the rubric scoring process. Next, I will review the non-research scoring rubric that will be utilized by reviewers for evidence-based practice and quality improvement projects poster abstract submissions. The title and introduction character count must not exceed 875 characters inclusive of spaces. The reviewers will then assess the following qualifying criteria. If the answer to the qualifying criteria is yes, the score will receive a 1. If the answer is no, they will receive no points, and it is asked that the reviewer provide a comment for all no scores. The first question is, does the title reflect the project? Yes or no? The second question, are the project purpose and goals clearly defined? Following question, is the significance of the healthcare problem well established? And is the project initiative supported by evidence? The non-research scoring rubric continues with the methods section. The methods section limit is 1,050 characters, including spaces. The criteria questions are again answered with a yes or no response are not applicable. Please provide a reviewer comment if you select no. Is the methodology clearly described? Are research ethics adequately addressed, such as protection of live subjects? Is an implementation plan or process described? Is a plan for data analysis and/or evaluation described? The next section of the non-research scoring rubric are the results. If the project was not implemented and only a plan for implementation was described, the results section will be omitted and the reviewer will move to the next section of discussion. If the project was implemented, the following criteria questions will be asked based on a yes or no response. If a no response is provided, the reviewer again is asked to provide comments. The following criteria questions will be asked of the implemented projects. Are the results reported in a clear and concise manner? Are the results aligned with the project initiative, purpose, and goals? Does the data analysis support results? And is the interpretation of the results sound? The discussion character limit is 1,050 characters, including spaces. The criteria questions include, are the discussion and conclusions supported by the results? If the project was not implemented, this question will be omitted. The next question that will be asked are the implications and recommendations for clinical practice discussed. And lastly, are the project initiative limitations discussed adequately? The next section addresses writing style and format. The following criteria questions will be asked. Are the guidelines for poster abstract submission followed? Is APA format correct? Is correct grammar, punctuation, and sentence structure used? Is the abstract logical and well organized? Tips and tricks to note. The reviewer rubrics evaluate each section of the abstract. If the template is not followed or a section is missed, the reviewers may select no for a criteria and a score of 0 can be given. Please note you should ask a faculty member or a peer who has published to review your abstract before submitting. Character limits are hard stops. If your abstract is over the character and space limit, you will not be able to submit, or you will be notified of an incomplete submission. Be sure to simply and clearly describe why your project matters. Clearly describe what you did. Detail the project implementation or the plan for implementation. If you describe a plan for implementation, it must exceed practice recommendations and detail how incorporation of the evidence could be integrated into practice. Analysis must support the results. Be sure to review recommendations and implications to practice and identify any limitations. Tips and tricks for the reviewers. Is the project question clearly stated and important? Is the project method appropriate and well described? If the project is implemented, are the results clearly presented and supported by the data? Are there conclusions provided and are the limitations described? Is the abstract written in a clear and concise manner? And is the topic of the abstract in the scope a good fit for the meeting? The AANA Foundation Task Force for Poster Abstract Submission thanks you for your time and interest in submitting quality poster abstracts.